Fluoride exposure and concerns for its effect on neurocognitive development has been getting a lot of attention recently. There are dozens of studies that show at least a correlation of higher fluoride exposure to lower IQ, although the quality of these studies varies greatly. In this episode, we'll break down a high-quality study that was published in the Journal of the American Medical Association's Pediatric Journal in 2019. This study is titled Association Between Maternal Fluoride Exposure During Pregnancy and IQ Scores in Offspring in Canada. This is a prospective cohort study that followed 601 pregnant women and their children in 6 major cities in Canada. The study explored the association between maternal fluoride exposure during pregnancy and the cognitive abilities of their children assessed by IQ tests at ages 3 to 4. They stratified the pregnant women into 2 groups. The intervention group included the pregnant women that lived in an area with fluoridated water, and the comparison group was women that lived in an area with no fluoridated water. They also took urine samples of the pregnant women in all 3 trimesters of their pregnancy, and unsurprisingly, they found that the women that lived in an area of fluoridated water had higher levels of fluoride in their urine. They also tested the mother's urine for particulates that also could possibly change cognitive development, including mercury and lead, to control for those factors. Interestingly, amongst the boys, they found that for every 1 milligram per liter increase of fluoride in the mom's urine during pregnancy resulted in a 4.49 point decrease in their IQ testing at ages 3 to 4. That was found to be statistically significant with a p-value of 0.02. But also interestingly, they found no statistically significant difference in the girls' cohort. When they combined the data of the boys and the girls, they found that that same 1 milligram per liter increase of fluoride in the maternal urine resulted in a 3.66 decrease in IQ scores amongst boys and girls, and that was found to be statistically significant with a p-value of 0.04. While no study is perfect, this study is of very high quality, and part of the reason for that is it's unique in an ecological or a public health study to have a prospective design, meaning that they were able to sample these pregnant women at the time of their pregnancy and then follow them into the future and follow their children into the future to test them. Most studies that test things that are of our environment are retrospective, meaning you have a result and then you look back for exposures, and that makes it harder to prove causality. Another reason that this study is helpful in the conversation about fluoride exposure and neurocognitive development is that none of the women were exposed to fluoride levels that are above the recommended value. In North America, that's 0.7 milligrams per liter. There are many other studies out there that have shown a decrease in IQ with higher fluoride exposure levels, but a lot of those studies come out of China and India where the fluoride exposure levels are much, much higher. I hope this was helpful. For future scientific article analysis, be sure to give us a follow.